Hello, everybody. It is a pleasure to be here as a guest of Asha to talk about COVID-19 and give an update on where we've come with COVID over the last few months and potentially give you a glimpse as to where things are headed in the US. So, the very first case of COVID was reported in the United States on January 21st from the state of Washington. This was in a patient who had traveled from Wuhan, which at that time was the epicenter of an outbreak of a viral illness caused by the coronavirus. This probably began in Wuhan sometime in the middle of December, and by January, they had had about 80,000 cases of this highly infectious respiratory illness with a very high rate of death in people who were affected by this. We had our first case here in January in a traveler who had come back from China. And at that time, we instituted some travel bans. We didn't think it was going to be a big problem, and definitely the US government at the time really downplayed it. Over the course of the next few weeks, we had a handful of cases here and there. But starting around middle of March, cases started to really take off. And by April 29th, we had reached 1 million cases of COVID in the US. At that time, the majority of the cases were in New York, and shortly after that, other parts of the East Coast, but that's where the outbreak was localized. As you can see from this slide, it took us another 43 days to go from 1 million to 2 million. And after that, the amount of time it took to add another million cases really dropped significantly because cases were spreading exponentially. At the time of this speaking, we've had several million cases of COVID, over 23 million cases. We've had over 660,000 deaths due to COVID. Many of which, especially the ones in the last few months, have really been preventable. So, what was so different about this virus that allowed it to spread so rapidly and cause so much suffering around the world? One was this virus was very easily spread from person to person. So we think about influenza, and typically about two people acquire influenza from each case of influenza if the person is not careful about staying home when they're sick. With COVID, that number is much higher, so it passes much more easily from person to person. The other thing about COVID is that there is what's called asymptomatic transmission. So not everyone who gets COVID has symptoms, but they still have large amounts of virus and they can pass it on to others. And even people who have symptoms are actually highly infective 2 days prior to the onset of symptoms. So both of these two things together make it very likely that infection will spread from person to person. The next thing is mortality. So there are diseases that are much worse than COVID. So the first SARS-CoV-2 outbreak, for instance, a few years ago also began in China. And this illness was associated with very high mortality rates. So 1 in 20 to 1 in 10 people were dying from this illness. When an illness has such bad outcomes, people tend to take it seriously. With COVID, the mortality is much lower. It's about 1 in every 100 people die of the illness. So this means that all of us have encountered people who've had COVID and recovered, and these people talk about their illness quite a bit and say it was nothing, it was just the flu. So that spreads the impression that this disease isn't actually as bad, and so people tend to not to take it as seriously. So this again allows the disease to continue to spread and continue to cause a lot of cases around the world. So in the US, I wanted to kind of show you where we are. We had our initial surge that was confined to New York and some parts of the East Coast in March to April of last year. And then around the country, we had a little bit of a second surge with a max of 60,000 cases per day in July, August of last year. But our really big surge was between November and January of last year. This was the entire country was affected, including us in Rochester and Olmsted County. And at one point, we were hitting as many as 250,000 cases per day. That began to come down as we started rolling out vaccines and became more careful with masking and social distancing. And we really, with vaccine taking off in March and April, we came down to very low levels of transmission and very few cases in June, early July. And then since then, we've been in the midst of our fourth wave in this country. Now, when it came to deaths were highest during the very first surge, and this was due to a couple of different reasons. One was we didn't know enough about COVID. We were using therapies to try and treat COVID that probably did more harm than good. That was one big reason. The other thing was that the entire healthcare system in New York State was overwhelmed, particularly in New York City. So anytime you don't have access to good healthcare, when healthcare workers themselves are getting sick and dying from COVID, the entire medical system collapses and mortality is much more than it would be otherwise. And you can see that with the second, third, and fourth surges, our deaths have not been quite as high because the cases have been distributed over a wider period of time, and we now know how to manage COVID better than we did before. So I know that a lot of us on this call today are from India or have ties to India. And so I wanted to kind of put India's outbreak into perspective too. India actually did an extremely good job of controlling COVID in the early months. Part of it was the extreme lockdowns. India had one of the strictest lockdowns in the world. And this went into effect at the end of March when India had actually only had about 11 cases of COVID. All of us were very afraid about what was going to happen based on what we'd seen in China and what was going on in the US, because India is so densely populated and an infection can spread so much more rapidly there. But mostly as a result of the lockdown, India had very, very few cases and did remarkably well. And even as lockdown eased, cases did rise, but nowhere near as bad as we thought it would be. And that probably got us all a little bit overconfident. There were a lot of theories from the medical community even that perhaps the Indian population had been exposed to so many different viruses that might have been related to coronavirus that Indians were immune to the virus, didn't suffer as many consequences from the virus, and that we would be fine, that COVID was behind us, things could go back to normal. And things did relax considerably by the end of the year. By December 2020, really, there was no masking anywhere. There were no restrictions on gatherings. And there were many, many mass gatherings for religious reasons, for political rallies. The elections were on in February and March, and all of this resulted in a really ferocious second wave in India. In addition to the fact that all these COVID preventive measures had been relaxed, the other thing that had happened was there was low levels of cases occurring in India, and the virus was multiplying and changing, and a new variant had emerged in India called the Delta variant that was now much, much more infectious than the original strain of the virus, was able to spread more rapidly, and also caused faster decline in the clinical status of the patient, which meant that there were huge numbers of patients that needed medical care. And of course, the Indian system was not able to handle that huge demand, and there was utter collapse in many parts of the country, particularly in New Delhi. And there were the medical system being overwhelmed meant that there were not enough hospital beds, there was not enough oxygen, there was not enough equipment, including ventilators to treat patients, not enough of the right drugs, wrong drugs were being used rampantly, and there was really a devastating second wave with very, very high death rates. You can see here that based on the official data, at one point in time, there were close to 5,000 deaths per day in India. But that number is, it's been suggested that that number was probably an underestimate by a count of 10, suggesting that there were about 50,000 cases 50,000 deaths per day in India. And I do think that that number is probably closer to the right figure than the 5,000 that's put out officially. Things have improved considerably in India, and India's case counts are much lower than that in the US right now. And we are hopeful that with the vaccination campaign, the rate at which India is able to vaccinate now, that there won't be a third wave, or if there is a third wave, it won't be anywhere near as bad as the second wave was. So what about Minnesota? Minnesota, as you can see here, has pretty much mirrored the situation in the United States. We've had our own waves that look just like the US case counts. And we are now also in our fourth wave, and we, in Olmsted County in particular, have had an increase in cases in the hospital, in a large number of vaccine breakthrough cases, but most of the cases in the hospital are actually in unvaccinated people, not vaccine breakthrough cases. So what do we now know about the coronavirus? This is a simple schematic of the coronavirus. The virus is what's called an mRNA virus. In the yellow part is the mRNA within the cell, and on the surface of the cell it has these red spikes, which are called the spike protein. These spike proteins play a critical role in how the virus attaches to cells in the human body, and how it sets off the infection. So the spike protein has also been the target of all the vaccines for coronavirus, the spike protein, and I'll talk about that in a minute. So all of the vaccines that we have currently in the US, I have listed here. There are some other kinds of vaccines available in other parts of the world, but I thought I would just focus on these three. The Pfizer and the Moderna vaccine are what are called mRNA vaccines. These vaccines are take the mRNA from the virus, and the mRNA by itself can't make you sick or cause you to have an illness. What the mRNA is really kind of like a recipe card. It tells you how to make spike protein. This mRNA is wrapped up in lipid particles, and that's what forms the vaccine. When this vaccine is injected into you, it enters your cell and instructs your cell on how to make the spike protein. The spike protein then leaves the cell, comes out into your circulation, and stimulates the immune system to react to spike protein, to recognize it. And the next time, if the virus enters your body is primed. It has all these antibodies, it has all these killer cells that can work against the virus and destroy it and keep you from getting sick from the infection. The J&J vaccine is a viral vector vaccine, and it works almost the same way as the mRNA vaccine. All that's different is the mRNA, instead of being in this lipid envelope, the envelope that surrounds the mRNA is actually another virus, and this, in the case of the J&J vaccine, it's an adenovirus. And this adenovirus protects the mRNA until it gets into your cell. Once in the cell, again, the mRNA does the same thing, teaches your cells how to make spike protein. I've listed the schedule. Both Pfizer and Moderna were 2-dose series. Some people may need 3 doses. The J&J vaccine at this point is a 1-dose vaccine. All of the vaccines have some side effects. They give you some headache, body ache, some pain at the site of the vaccine. All of these are minor, resolve in a couple of days. There are very rare side effects that you should just know about. And for the mRNA vaccines, it's anaphylaxis or a severe allergic reaction to the vaccine, or myocarditis, which is inflammation of the heart muscle. And with the J&J vaccine, it's clotting complications. All of these vaccines were very, very effective in the vaccine trials. And in the vaccine trials, of course, you have a very controlled situation. What is reassuring is in the real world, after the vaccines were launched, and especially even in recent weeks, when we've had variants circulating, the vaccines still are quite effective at preventing hospitalization, although their effectiveness at preventing infection altogether does not seem to be as good as it was in the trials. So where are we with vaccination in the US? We took off, the vaccine program really took off in March and rapidly vaccinated a large number of people. And as you can see, in the last few weeks and months, the pace of vaccination has really slowed in the US. At this point, 64% of the population has had at least 1 dose of vaccine. When you count only the people 12 and older, the ones who are now eligible to get vaccinated, that number is a little better at 74%, with 64% being fully vaccinated. But what is reassuring is that in the group of individuals that is at highest risk of COVID, those 65 and older, the fully vaccinated rate is at 83%, which is good news. Now, one reason why we haven't really been able to move the needle on vaccination is that there is a very, very vocal group of individuals who are opposed to vaccine. And we had a lot of demonstrations, especially in recent weeks, as more and more healthcare systems are mandating vaccine, with healthcare workers themselves now demonstrating against vaccination. And this is a movement that is not unique to the US. There are vaccine objectionists all over the world, but it seems to be particularly bad in the US. And you can see that as a result of this, although the US was one of the first countries to start the vaccination program and is also the country with the most resources to distribute vaccine, the most access to vaccine, we're still kind of midway or in the middle of the pack when it comes to vaccination rates. Now, overall, 43% of the world's population has had at least 1 dose of the COVID vaccine, but that isn't distributed equitably around the world. You can see that some countries, especially in Africa, have less than 1% of their population fully vaccinated. And that means bad news for the world as a whole, because unless we are all safe, no one is safe. So what happens when there are highly vaccinated populations and poorly vaccinated populations simultaneously? The virus takes the path of least resistance and does infect those populations that have low vaccination rates. Now, every time the vaccine infects an individual, the virus is multiplying in that individual. And every time the virus multiplies, it's making a copy of itself. During this process of making copies, there are tiny mistakes that are made. And when these mistakes accumulate enough that the virus behavior changes, that's what results in a new variant. So the more infections that are happening anywhere in the world, the more likely it is that you will have a variant. And when you have a variant, again, the variant makes itself around the world, and no one is really safe from it unless you're willing to really put very, very strict travel restrictions in place. So that's exactly what happened in the US. So the Delta variant, as I said, likely arose in India because there was a lot of silent cases happening in India with the virus multiplying. And the virus then made its way out of India, made its way to all the neighboring countries and also to the United States. By June, roughly 20% of cases in the US were caused by the Delta variant. And you can see, which is the orange line, the B16172 variant. And you can see how that has spread and increased. And right now, close to 99% of all cases in the US are caused by the Delta variant. So unless every country in the world has access to vaccine and is able to vaccinate its population, just the US getting multiple boosters will not be enough to protect the US population, because what will happen is a new variant that is more vaccine resistant will eventually make its way to our shores. So the other question that a lot of people have is, with the new variants, is does the virus behavior change? So one thing we know about COVID-19 is, unlike influenza, where the virus actually causes more significant sequelae in young children, COVID-19 seems to be relatively mild in children. There can be some children who have serious illness, but by the majority of children have asymptomatic or very mildly symptomatic infection. So there has been concern as the new variants come around that Delta perhaps could be more severe in children. And so far that has not borne out. So this graph, the red bars all show you the cases in people 65 and older. As we started vaccinating, you can see that the numbers of cases in this group has decreased, but the numbers of cases in children, which is this brown bar right on the top, has actually not increased significantly. It still remains a very small contribution. Most cases now seem to be in people in that working age group between 18 and 64 years. They have to go out to work, they can't stay home, they can't isolate, and if they're not vaccinated, they are more vulnerable to COVID. So we have learned a lot of things about COVID in the last few months. So one is that masks work. There was a lot of opposition to masks early on, I think, and this unfortunately still is in certain parts of the country, but parts of the country where masks have become accepted, and actually parts of the world where masks have become second nature, are doing better than other parts. Vaccines are effective at preventing infection, preventing illness, preventing death. Monoclonal antibodies have also been important. So monoclonal antibodies are just concentrated spike antibodies that if you haven't been able to mount enough of a response to your vaccine, if you're unvaccinated, if we give them to you, it acts like an immediate vaccine and reduces the likelihood that you will become sick. Monoclonal antibodies can also be used for early treatment of illness. So if you have mild symptoms, giving you those antibodies can again overwhelm the virus, keep you from getting sick. The other things that work are supportive care, good standard care, including prevention of blood clots, giving you oxygen, giving you a ventilator if you need it, can all help reduce the chances that you die from illness. Steroids, which reduce inflammation in your lungs, and certain other types of immunomodulatory medications that do the same thing, can help reduce the risk of dying. And again, these medications actually have an extremely short supply in the US currently because of the high numbers of cases. So we've talked about where we've come, what the last few months have been like. What does the future hold? One thing that is being heavily debated right now is whether or not infection from the whether protection from the vaccines wanes and whether we need booster doses. That's still a topic that is in evolution. And right now, what is recommended is a third dose for people who are immunosuppressed. This is not a booster. This is just you don't respond enough to 2 doses, so we're going to give you a third dose. It's very likely that in the next week to 10 days, there will be some recommendations on actual boosters. So, and I'm hopeful that it won't be everybody needs a booster, but certain groups of individuals, such as people over the age of 65, might need to have a booster. And the other group that is being recommended for boosters is healthcare workers who are at high risk of exposure to COVID. Masking is probably something we're not going to give up completely. There will be periods of time, I think, where we can relax masking, but there will be periods of time when there are flares of COVID in local areas where we will need to mask again. Travel restrictions, I think that we will again continue to have some travel restrictions that will vary day by day, month by month, at least through the end of 2022 until the whole world can get vaccinated. And even after that, I think this has really given us some pause, and we might have to think about leisure travel, maybe explore our local communities for leisure travel and travel for either essential business or to visit family to more distant locations and keep our leisure travel more local. So I think this is what our future holds. And again, some of the other lessons we've learned is that communities that believe in science, countries that believe in science have fared better than others. And we need to continue to focus on all staying informed and doing the right thing when it comes to COVID. I'll end here and I'll be happy to take questions.